St. Kitts Nevis need to take this COVID-19 thing serious. The more cases we get, the more the place gone locked down. Y'all making noise, but y'all still ain't doing what y'all supposed to do. Stop all your yard and use all your masks. That's the only thing gonna help right now.
Before touching the mask, clean hands with an alcohol-based hand rub or soap and water. Take the mask and inspect it for tears or holes. Orient which side is the top side, where the metal strip is. Ensure the proper side of the mask faces outwards, the colored side. Place the mask to your face. Pinch the metal strip or stiff edge of the mask so it molds to the shape of your nose. Pull down the mask's bottom so it covers your mouth and your chin. After use, take off the mask. Remove the elastic loops from behind the ears while keeping the mask away from your face and clothes. To avoid touching potentially contaminated surfaces of the mask, discard the mask in a closed bin immediately after use.
I am Officer Donnelly Liebert Shiverton. Do you want to travel and don't have private transportation? Here are some travel safety tips to keep yourself and the persons around you safe from the coronavirus. When venturing out in public, it is recommended that you wear a mask at all times. Sanitize your hands before and after entering public transportation. The bus operators are also encouraged to sanitize their buses after each trip. Remember, always practice good respiratory hygiene. That means refraining from touching your face with unwashed hands. Always practice physical distancing. To maintain physical distance, the government of St. Kitts and Nevis stipulates that only 2 passengers are allowed per row. That is, 1 passenger on each end of the bus row, while 1 passenger is allowed to sit up front with the driver. This means that only 9 passengers are allowed in a passenger bus. Remember, stay safe, travel wisely as we work together to flatten the curve.
Is on.
We're doing our part to help making sure that the coronavirus doesn't spread anymore in St. Kitts and Nevis.
Our role here is just to ensure that the public being safe, and at the same time we're keeping ourselves safe. We're ensuring that each other keep at least 6 feet distance apart.
I like the fact that they put this into place, because most of the time the people are not honest. They tend to come and cheat, and many people who are here from since 6, 7 o'clock in the morning standing up waiting long, other people coming and excusing themselves within the line.
Some of them are 6 feet apart and the others are jumbled up too much on one another. Each supermarket where I attend, and even in the pharmacy, they're cooperating very well, and it's a good thing that they're doing. Very good.
I am very passionate about being here, performing my duties on the front line of COVID-19. Our job is not so easy, but we all know that someone has to do it.
It's not an easy job, it's not easy, very difficult, but however, country about self, and we managed to take on the task.
Prime Minister, you shall step up the police them money because they out here in the hot sun to keeping the people them from fighting and shoving in the line. And what they do is a very, very good job.
We're just trying to do our part to make sure that St. Kitts can actually recover from this.
Yeah, people of St. Kitts and Nevis need to take this COVID-19 thing serious. The more cases we get, the more the place gonna lock down. Y'all making noise, but y'all still ain't doing what y'all supposed to do. Stop all your yard and use all your masks. That's the only thing gonna help right now.
Before touching the mask, clean hands with an alcohol-based hand rub or soap and water. Take the mask and inspect it for tears or holes. Orient which side is the top side, where the metal strip is. Ensure the proper side of the mask faces outwards, the colored side. Place the mask to your face. Pinch the metal strip or stiff edge of the mask so it molds to the shape of your nose. Pull down the mask's bottom so it covers your mouth and your chin. After use, take off the mask. Remove the elastic loops from behind the ears while keeping the mask away from your face and clothes. To avoid touching potentially contaminated surfaces of the mask, discard the mask in a closed bin immediately after use.
I am Officer Donnelly Liebert Shiverton. Do you want to travel and don't have private transportation? Here are some travel safety tips to keep yourself and the persons around you safe from the coronavirus. When venturing out in public, it is recommended that you wear a mask at all times. Sanitize your hands before and after entering public transportation. The bus operators are also encouraged to sanitize their buses after each trip. Remember, always practice good respiratory hygiene. That means refraining from touching your face with unwashed hands. Always practice physical distancing. To maintain physical distance, the government of St. Kitts and Nevis stipulates that only 2 passengers are allowed per row. That is, 1 passenger on each end of the bus row, while 1 passenger is allowed to sit up front with the driver. This means that only 9 passengers are allowed in a passenger bus. Remember, stay safe, travel wisely as we work together to flatten the curve.
Is on.
We are doing our part to help making sure that the coronavirus doesn't spread anymore in St. Kitts and Nevis.
Our role here is just to ensure that the public being safe, and at the same time we're keeping ourselves safe. We're ensuring that each other keep at least 6 feet distance apart.
I like the fact that they put this into place because most of the time the people are not honest. They tend to come and cheat, and many people who are here from since 6, 7 o'clock in the morning standing up waiting long, other people coming and excusing themselves within the line.
Some of them are 6 feet apart and the others are jumbled up too much on one another. Each supermarket where I attend and even in the pharmacy, they're cooperating very well, and it's a good thing that they're doing. very good.
I am very passionate about being here, performing my duties on the front line of COVID-19. Our job is not so easy, but we all know that someone has to do it.
It's not an easy job, it's not easy, very difficult, but however, country about self and we managed to take on the task.
Prime Minister, you shall step up the police them money because they out here in the hot sun to keeping the people them from fighting and shoving in the line. And what they do is a very, very good job.
We're just trying to do our part to make sure that St. Kitts can actually recover from this.
Yeah, people of St. Kitts and Nevis need to take this COVID-19 thing serious. The more cases we get, the more the place gone locked down. Y'all making noise, but y'all still ain't doing what y'all supposed to do. Stop all your yard and use all your masks. That's the only thing gonna help right now.
is on.
Good day and welcome back. This is the National Emergency Operations Center COVID-19 briefing for the 10th of June 2020. I am Lesroy Williams. We're happy to be back after a 6-day break in which we had all the election excitement and the celebrations thereafter. We were on the mountaintop. It was a mountaintop experience, but life is not lived on the mountaintop. Life is lived in the valley, and that is where we now are. We still have the pandemic, the COVID-19 pandemic, and its impacts on our everyday social, economic, and political life to deal with, to manage as best as we could. Thank you very much for joining us for this briefing. And of course, we continue to update you and to provide you with important information with respect to where we are with the COVID-19 pandemic and where we are going. Of course, all of us have felt the impact of the pandemic, some greater than others, but we have all felt the impact, and we are doing all that we can to lessen that impact and eventually to get back to normal, or should I say, the new normal. Today, of course, is also a very significant day in the political history of St. Kitts and Nevis. We know of what was called the Anguilla Revolution, June 10th, 1967. I don't intend to get into that, but it's a part of our political history that cannot be erased. Today, I would like to invite Dr. Lincoln Carty to make a donation on his own behalf to the COVID-19 response. Dr. Carty.
A very pleasant good afternoon, everyone. And thank you very much, Mr. Williams and the rest of the team for allowing me to come and participate in this activity. Before I make my presentation, I would like to say how grateful I am to the team of individuals who came together to take care of our Federation of St. Kitts during this pandemic. It would be difficult to begin to mention names because that would take time. But I would just say to our team here at the NEMA, the NEOC, the various first responders, nurses, doctors, all those individuals who would have participated in taking care of individual cases, taking care to ascertain that our borders were secure, and to the government especially of St. Kitts and Nevis for ensuring that every one of the citizens of this country were protected from the pandemic. And so I want to just give a high note of praise and gratitude to all those who would have participated. And that brings me to the reason why I'm here today. The idea of making the kind of presentation I'm making today did not originate with me. In fact, it actually came as a result of me listening to the news one night of what was taking place in the United States of America. And there was a citizen who was speaking to a reporter, and he, at that time, was paying tribute to the various first responders, and he enumerated the different groups of individuals who would have responded. And as he came to a close, he said, there is one group that is just about forgotten. And he said, this group are the baggers in the various supermarkets. He said, people seem not to be paying much attention to them, but they are also on the front lines because they're interacting with individuals. And as he said that, it struck a chord with me for the simple reason that when I was in high school, Erasmus Williams, if he is looking, he would remember both of us used to do that work at Casab Grocery. Yes, Casab had a grocery right there on Liverpool Row. And so on Saturdays, we would go down and we would do our work there. And so I appreciate what many of our young people are doing today in that respect. And so I thought, that as a result of hearing what the gentleman said, when I go to the supermarket the next time, I'm going to make sure I give a big tip to whoever bags my groceries that day. But the more I thought about it, I recognized the fact that as an individual, I could give a tip to one person, or maybe two, because there are some stations which have two individuals doing the bagging. But that's as far as the contribution would go, one or two persons. But there are so many individuals in the various supermarkets, and I do shop at most of the, in fact, all of the supermarkets in Bastille, I go to them, but more regularly I visit some than others. And so I decided that in order to show my gratitude to these individuals, and by the way, here in St. Kitts, they are not referred to as baggers, but I learned that they are referred to as courtesy clerks. And so in order to show my appreciation to our various courtesy clerks, I decided to give a gift voucher, a gift certificate to every single one of those courtesy clerks in the three main supermarkets that I shop at. That is the Rams, and there are three divisions of Rams at Camps, the Bay Road, and Bird Rock, and I visit all of them from time to time. Best Buy has two supermarkets, and I shop at both of them, and Value Mart has one, and I'm there on occasions as well. And so I made a check and found that there were 68 courtesy clerks who worked through the period of the pandemic and are still working through. And I decided that I would give each one of them a donation. And that donation is going to come in the form of a gift voucher. So I'm going to ask Mr. Abdiel Samuel, our director here at NEMA, to come and accept a token contribution on behalf of each of these individuals. They will each in the various supermarkets receive their personal gift vouchers, but we have just a prototype of the gift voucher here, and I want to share with you what it says, gift certificate, and this is redeemed in the amount of $3,400, This certificate entitles 68 courtesy clerks to the purchase of merchandise and products at Rams, Value Mart, and Best Buy supermarkets, signed by me, dated today, 10th of June, 2020. And with all transactions, there are conditions. And because of my interest in the health promotion and in the care of the body, I've decided to put just 2 conditions to this one. The first is that it is not redeemable for cash, and the second condition is that it is not valid for the purchase of alcohol or cigarettes, simply because mostly young people and we want to teach them to take care of their bodies. So, Mr. Samuel. Yes, thank you very much. I just want to salute every single courtesy clerk in our supermarkets right here in Bastille. And I just want to say to them personally, I thank them for the contribution that they have given to us. So all of you, I thank you very much. May Yahweh richly bless you, and I trust that you'll continue to bless every citizen and every resident of our beautiful land, our land of beauty. Thank you very much.
Good afternoon all. I want to thank Dr. Lincoln Cathy for his contribution. Again, we continue to see our citizens rise to the occasion and acknowledge all of our citizens, even those who do things that sometimes we don't even acknowledge ourselves. So thank you, Dr. Cathy, and may the good Lord bless you.
Thank you very much, Dr. Carty, for that conscientious donation given to the courtesy clerks of various supermarkets. I now invite Superintendent Cromwell Henry, Divisional Commander for District A, to give his report on the regulations under the state of emergency.
Thank you, Mr. Williams, and a pleasant good afternoon to all. We have just concluded election campaign and polling day were free of violence or any incident that was capable of marring the activities. The police wish to thank residents for your civility in this regard, and I dare say your cooperation. We also wish to remind the public that the COVID-19 regulations are still in effect and is being enforced by the police. Retail liquor licenses remain suspended, social events and other similar gatherings are restricted, and visits to the beach are limited to the periods between 5:30 and 10 a.m. daily. The nightly curfews that were temporarily suspended for 3 nights from June 4th to 6th have since resumed and take effect from 8:01 p.m. nightly to 4:59 a.m. the following day. All the other provisions and protocols, which I'm certain that we are all aware of, remain in effect and enforceable. I wish to bring a particular provision of the regulation to your attention as we see conflicts in the lines at some of the business establishments as patrons wait to enter. Regulation 1612 provides that during a day of limited operation, seniors, disabled persons, and essential workers with identification shall be granted priority to enter any business or enterprise. We ask businesses to bring this provision to the attention of your security personnel who are managing the lines. Remember, essential workers are members of the Royal St. Christopher Nevis Police Force, the St. Kitts Nevis Defence Force, the Fire and Rescue Services, the National Emergency Management Agency and the Nevis Disaster Management Department, the NEOC and the HEOC, that is the National Emergency Operating Center and the Health Emergency Operating Center, and members of staff of any other disaster management services. The prisons, correctional facilities, and other establishments, any hospital, health care, or medical facility, Customs Department, Immigration Department, Air and Seaports Authority, members of the media personnel, Office of the Director of Public Prosecution and the Attorney General Chambers, members of Parliament, the Secretary to the Cabinet. These persons are considered essential workers and should be granted priority in any lines at any business establishment. The current regulation number 19 of 2020 will expire at 6 a.m. on Saturday, 13th June, when we expect that new regulations will be published. I'd like to end my presentations with my usual appeal to motorists to begin to make your way home in sufficient time to avoid having to drive in a manner that is dangerous to the public and that will increase your risk of accidents. Remember, gas stations and supermarkets should close at 6 p.m., while shops and other small establishments should close at 7 p.m. Thank you.
Thank you very much, Superintendent Henry. I now invite Dr. Hazel Laws, our Chief Medical Officer, to give us the Health Emergency Operations Center COVID-19 Situation Report. Dr. Laws.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. This afternoon, it's my task to share with you the Health Emergency Operating Center Situation Report for today, Wednesday, June the 10th, 2020. The World Health Organization tells us that to date, there are over 7 million persons impacted by COVID-19. And when you look at the data as at May 14th, that's almost a month ago, you can see that there has been an increase of almost 3 million persons within that short space of time. The total number of deaths today stands at 407,159. And again, you could see there has been an addition of over 100,000 persons between May 14th to present. And so the COVID-19 pandemic continues globally. Now, closer home in the Caribbean sub-region, when we refer to the Caribbean sub-region, we are really speaking to about 33 countries or territories close by. And as at June 8, 2020, there were 33,157 confirmed cases within the Caribbean region. And based on the data, if you look back to what the figure was on May 14th, it was just at a little over 17,000. And so you can say basically the figures or the numbers have doubled in less than 1 month. There is hope in terms of recoveries within the Caribbean region. We've had over 15,000 persons recovering. In terms of deaths, the death toll in the Caribbean region is almost 100,000. It's at 937, and on May 14th it was 728 persons. Now let's come closer home to St. Kitts and Nevis. To date, we have tested approximately 417 persons, and 402 of those results have returned negative, and as we speak, we do not have any samples being processed or any results pending. In our government designated facility, we presently have 13 persons, and to date we have almost 830 persons who would have been released from quarantine, and that's between January of this year to present. So to date, St. Kitts and Nevis have only had 15 confirmed cases who have all recovered. So at present, we have 0 active cases. Actually, it's approximately 52 days since we would have announced our last case, and that would have been round about the 19th of April or thereabout. So, where are we? Today, June 10th. Again, we have 0 active cases. So yes, we would have contained the first wave of the COVID-19 cases. So the Ministry of Health continues active surveillance. So basically, we are focusing on all those patients who would be accessing care at the various health centers, St. Kitts and Nevis, and the hospitals, who will be accessing care for respiratory symptoms and other COVID-like symptoms. And so over the next 1 to 2 weeks, we will be looking closely at those numbers. And then I want to just underscore that our borders remain closed. Based on the fact that we have 0 active cases, we continue gradual relaxation of restrictions. Now, this process continued today. We had a very successful, I would say, stakeholder meeting this morning at the Royal St. Kitts Hotel, whereby the COVID-19 task force would have collaborated with the Ministry of Tourism and the St. Kitts Tourism Authority. We would have met with all the restaurant and bars, all the operators of the restaurants and bars, and all the relevant stakeholders to discuss the reopening of restaurants and bars. Risk. Based on the fact that we have 0 active cases, it means that the risk of exposure to the virus within our closed borders is reducing. However, based on the latest situation report coming out of the Caribbean Public Health Agency, we are being told that the risk of further cases occurring in the Caribbean region remains very high. And you and I are aware that the risk of further cases occurring further afield is also extremely high. And so it follows that if and when our borders reopen, there's a high risk of the virus being reintroduced into the Federation. And so what are we doing at present? The Federation's response to COVID-19 continues, even though we have 0 active cases. And our response continues to be guided by the World Health Organization, the Pan American Health Organization, the Caribbean Public Health Agency, and the Ministry of Health. And the measures include: we continue to coordinate, plan, and monitor our COVID-19 response. Our risk communication continues, and so we continue to engage the public and share with you the latest information regarding COVID-19. And this forum is one such means of engagement. Active surveillance continues, whereby we are continuously monitoring for patients who would be accessing or seeking care for COVID-like symptoms. Our response teams continue to be trained In terms of our laboratory capacity, it is with pleasure that I share that the Ministry of Health, and in particular the JNF General Hospital Laboratory, just received a molecular machine whereby we can offer the molecular test at our public institution. We continue infection and prevention and control in terms of capacity building for our response teams, and we continue maintaining the delivery of essential health services during the pandemic. And then again, we cannot overemphasize the importance of our continuing to adhere to the physical and social distancing measures. We have been speaking about the potential of having a second wave, and again the Ministry of Health continues to prepare itself for same. So at present we are reviewing our response so far. In other words, we are reviewing what we would have done between January to present. We are noting our successes, we are noting the gaps, and we are plugging the gaps. And in so doing, we are strengthening our health services. We continue training our staff, and so capacity building is a priority as we continue our preparedness and response for COVID-19. Thank you.
These activities to assist and desist from doing so, please. The Compliance Task Force continues its work, visiting a number of businesses. And as we look at the businesses that they would have visited, from salons, clothing stores, doctors' offices, supermarkets, restaurants, village shops, even government departments. And these assessments reveal that we are doing quite well in terms of compliance. Today, as Dr. Lara said, we would have met with the bar owners and restaurant owners as well. And we see that the compliance is much, much better. The personal hygiene is superb, be at 100%. And we want to encourage everyone to continue to do so. Again, today, we met with the Ministry, in collaboration with the Ministry of Tourism, we met with the restaurant and bar owners, and we are hopeful that we can address some of their concerns in the upcoming regulation. Yesterday, June 9th, we would have met with the University of Medical Health Science in order to provide them with some guidance so that some of the students can have access to their computer labs, etc. So the task force has been busy addressing a number of concerns nationally. Today we would have had 7 students who are studying in the United States repatriated to St. Kitts. As we speak, they are being processed and taken to the quarantine facility at the OTI. I wish to acknowledge the Caribbean Disaster Emergency Management Agency, CDEMA. CDEMA would have, through the Regional Security System, RSS, would have delivered a number of PPEs as a sponsorship from the Southcom Humanitarian Assistance Project, assistance from Southcom. There were 62 hazmat suits, hand sanitizers, surgical masks, face shields, gloves, and shoe covers. These are some of the items, as outlined, that were donated to the Federation of St. Kitts and Nevis. And I want to thank the team from NEMO, led by the Deputy National Disaster Coordinator, Ms. Clarissa Langley Stevens, and supported by Ms. Vesta Southwell, and other members of NEMA. And also I want to thank the media for covering this activity. I also wish to thank the Comptroller of Customs, Mr. Kennedy De Silva, the Chief Immigration Officer, Ms. Moslin Hughes, and Mr. Dan James, the CEO of SCASPA, for facilitating this exercise. I wish to also acknowledge the Wesleyan Care for contributing $6,000 to our country's COVID relief efforts for the vulnerable. I think these efforts are timely as we continue to support the relief efforts, in particular those persons who are vulnerable. To the Wesleyan Care outreach arm of the St. Kitts District of the Wesleyan Holiness Church, thank you very much on behalf of the COVID-19 Task Force and by extension the government and people of St. Kitts and Nevis. Now the hurricane season is fast up. Well, we are in the hurricane season, and we're going to reach a time where we're going to reach the peak of that season. And the season begins to peak between August, September. And September is known as that month of the year where we get some of the strong, heavy hurricanes in this region. And I am appealing again to the general public to begin their preparedness measures, as this season is predicted to be very active. I want to thank you for listening, and we do look forward for your questions and hopefully answers that we can provide. However, let me just inform you that we have decided to reduce the number of briefings to 1 or 2 per week. So after today, you will see us again next week, Wednesday. So until next week, Wednesday, there will be no more briefing. So thank you very much, and Mr. Williams, back to you.
Thank you very much, Mr. Samuel, for your report. It is never good news to hear that we have an over-average Atlantic hurricane season, especially given what we're dealing with now with the COVID-19 pandemic. We pray that we will be spared any sort of a destructive storm. We now arrive at our question and answer segment. And the first question is for Dr. Laws. If there are no cases in the Federation now, and there have not been any cases for more than 3 incubation periods, why aren't all the restrictions relaxed now until the borders are opened or until there is another case?
Thank you for reading that questions, Mr. Williams. And yes, we have 0 active cases, and it has been quite a while since we would have announced our last case. However, I cannot put my head on a block and say we do not have a case in St. Kitts and Nevis, and that's why we continue active surveillance. And that's why the Ministry of Health locally and the regional organizations, CARFA, Pan American Health Organization, and World Health Organization, continue to underscore the need for us to continue our physical distancing and social distancing measures, along with the hand hygiene measures. Because you and I, we won't know if and when again the virus will be reintroduced into the Federation. And so the measures must continue, because for now, those are the interventions that are proven to contain the virus. And so we cannot stop, we have to continue.
Thank you very much, Dr. Laws. This next question is for Dr. Wilkinson. What have we learned from the successful handling of the coronavirus crisis in New Zealand? This country's Prime Minister has been lauded for her successful handling of the crisis.
Thank you very much, Lesroy. And first, let me say how happy I am to be back here at these briefings. We had a long hiatus, and it's nice to be back. Yes, it's true that New Zealand has been commended for their outstanding handling of the coronavirus crisis. As a matter of fact, the Prime Minister of New Zealand, Jacinda Ardern, said that she wanted to do a little dance when she learned of the last positive case there that was recovered. And she said that the entire nation rejoiced with her that they had not had a positive case in a long time. And so for us to talk about what we learned from the New Zealand model, first I must mention a few points about what New Zealand did and then compare what we have done here, and we can see how we can learn from them. So let me go through this. Now, New Zealand had a total of 1,504 cases and 22 deaths. And the last confirmed case in New Zealand was on the 22nd of May. And the question that has been asked worldwide is, how was New Zealand able to establish such a successful strategy in fighting COVID-19, such that they only had 1,504 cases and 22 deaths? Now, the cornerstone to their success, one, was their early lockdown, in that on March 15, when New Zealand had 100 cases, they locked down the country, and any New Zealander coming back home had to be quarantined for 14 days. Soon after the lockdown, they had a full lockdown where they only allowed essential travel to the grocery, etc. And it was thought that these restrictions are what were helpful in containing the spread of the virus. And now that they have contained the virus, they're beginning to open the country internally while the borders are still closed to international travel. Another reason for their success was the consistent messaging that they had, in that the Prime Minister was commended for having daily press briefings where they educated the public about COVID-19 and were able to have a buy-in of all of society in New Zealand. Thirdly, they ramped up their testing and ensured that every person who needed to be tested was tested. There are a couple other things that contributed to their success. The fact that it's a relatively isolated island, and so they were able to contain their borders, and the fact that they had a low population density. Now let's look at St. Kitts now. We had a total of 15 cases, 0 deaths, not 22, and our last confirmed case was on the 19th of March. We closed our borders after we had our first confirmed case, not after 100 cases. And our last confirmed case was on the, we closed our borders on the 25th of March, okay? And our last confirmed case was on the 19th of April. So to date, we have had just 15 confirmed cases, 0 deaths, and all of our patients are fully recovered. Now, we also had a consistent messaging where at our daily briefings, we engage all of society and made sure that persons were fully educated about the disease. Therefore, I can say that the model that New Zealand followed is basically the same model that we followed here. And we saw successes similar or even better to what was experienced in New Zealand. And so what I can say is maybe our Prime Minister need to do a dance, just like the Prime Minister of New Zealand. And maybe I can say that all of the persons in our country or society need to be celebrating the way the entire New Zealand population is celebrating their success. But because of the fact that we were able to contain the virus, we can now look towards opening the country internally first, and then we will have to address the tough question as to how we open to international travel. Thank you.
Thank you very much for your response, Dr. Wilkinson. This next question is posed to Dr. Laws. I was told there are new guidelines about masks from the World Health Organization. Do you have any information pertaining to this, Dr. Laws?
And yes, Mr. Williams, the World Health Organization has published updated guidance regarding the use of masks for the control of COVID-19. Now, as we are aware, masks are a part of a comprehensive strategy in the fight against COVID-19. And so this updated information is based on evolving evidence. So when I looked at what was published, here is what has not changed. All right, so the World Health Organization continues to recommend that persons who are sick with symptoms of COVID-19, they should remain at home and should consult their healthcare provider. People confirmed to have COVID-19 should be isolated and should be cared for in a health facility, or those who are mildly ill can be cared for in a private setting, and their contacts should be quarantined. If it is absolutely necessary for a sick person or a contact to leave the house, they should wear a medical mask. The World Health Organization continues to advise that people caring for an infected person at home should wear a medical mask while they are in the same room as the sick individual. The World Health Organization continues to advise that health workers use medical masks and other protective equipment when dealing with suspected or confirmed COVID-19 patients. Upon review of the new guidance, this is what's new. In areas with widespread transmission, WHO advises medical masks for all people working in clinical areas of a health facility, not only workers dealing with patients with COVID-19. So what does this really mean? What they're trying to say is that physicians, nurses, etc., who are doing a ward round on cardiology, palliative care units, in the doctors working in the radiology or the radiography rooms, etc., where there may be no confirmed COVID patients, they should still wear a medical mask. Secondly, in areas with community transmission, we advise that people aged 60 years and over, or those with underlying conditions, they should wear a medical mask in situations where physical distancing is not possible. Thirdly, the WHO has also stated that the use of masks by the general public, they have provided guidance on the use of masks by the general public in areas with community transmission. They advise that government should encourage the general public to wear masks where there is widespread transmission and physical distancing is difficult, such as on public transport, in shops, or in other confined or crowded environments. WHO advises that fabric masks should consist of at least 3 layers of different material. Masks are not a replacement for physical distancing, hand hygiene, and other public health measures. Masks are only of benefit as a part of a comprehensive approach in the fight against COVID-19. The cornerstone of our response, or any country's response, should be that of finding, isolating, testing, and caring for every case, and tracing and placing into quarantine every contact.
Thank you, Dr. Laws. This next question is for you also, Dr. Laws. How much hand sanitizer is enough, and is it safe to use in children?
That's a very good question, Mr. Williams. We are advised that we just need to apply a coin-sized amount of hand sanitizer on our hands and apply it appropriately. So there's really no need to use a large amount of the product. And so parents, we need to note that we must keep alcohol-based hand sanitizers out of the reach of children. We need to teach them how to apply it. We need to monitor its use, but we need to keep it out of the reach of children. And then those of us who use hand sanitizers, we need to avoid touching our eyes or mouth or nose immediately after using this product because it can cause irritation. Hand sanitizers recommended to protect against COVID-19 are usually alcohol-based and therefore can be flammable. Please, please do not use alcohol-based hand sanitizer just before going to the fire or cooking. Please. And then under no circumstance we are to drink or swallow alcohol-based hand sanitizers, and we really should not allow children to play with same. It can be poisonous. Remember, washing our hands with simple soap and water is just as effective against COVID-19.
Thank you, Dr. Laws. This next question. Dr. Wilkinson, neither you nor Dr. Laws are virologists or infectious disease specialists. It's been said that these two specialists should be a part of the team leading an infectious crisis like this. Do you think it's time we had an infectious disease specialist and a virologist on the team?
Thank you very much, Lesroy. Well, first let me say that although you see myself and Dr. Laws here at these briefings every day, we're not the only doctors who are part of the team, but we are part of the communication team that gets the message out to you. The same way Cromwell Henry is not the only police on the police force. There's a whole team working with him. So I just want to let you know that we have a whole team that is working behind the scenes to help us control this disease. We have anesthesiologists, radiologists, internal medical specialists, epidemiologists. As a matter of fact, every single doctor who is employed by the Ministry of Health is a part of the team. All of the nurses and the allied staff, those persons are a part of the team. And so I want to commend everyone who has put their hand to the till to help us be successful in what we've done so far, and I want to encourage you to continue to do your work. And if there's anyone out there who has anything to contribute, you know how to get in touch with us, and we'll welcome you to be a part, because we have said from the very beginning, we want all hands on deck. This is an all of society approach, and we attempt to engage every person in every aspect of society in this fight. I thank you.
Thank you, Dr. Wilkinson. This next question is for Dr. Laws. With the large motorcades and celebrations over the last few days, there was obvious disregard for social distancing. No social distancing constraints being observed, and also the wearing of face masks. Were you disturbed by this, and any advice going forward? Dr. Laws.
Mr. Williams, I really hope you would not have asked me such a question in public. As I observed what was happening last week, I must admit that I was greatly perturbed. And I feel compelled to say that persons would have, disregarded all the recommendations. However, the virus didn't pause. The virus continued spreading. You could look at the numbers that I, quoted earlier. And so the virus is not letting up. And so it's our role to continue preaching the same message and stressing and underscoring the importance of adhering to the physical distancing and social distancing protocols. These measures, along with the hand hygiene measures, are the non-medical interventions that have proven to contain this COVID-19 outbreak. That's all we have right now. We do not have a vaccine yet. We don't have any proven therapeutic medications. And so it's our role to continue encouraging the public and convincing the public that we need to continue adhering to these measures. Please, I implore you.
Thank you, Dr. Laws. I guess what we are seeing on cable television is large groups of gatherings of protests and demonstrations in the United States, of course, which is a hot spot for the coronavirus, and in other places around the world. And I think the question, that can be asked is, what would we see down the line coming out of these protests, these demonstrations? Will there be a spike in the transmission of the virus? It all remains to be seen, but there is a high probability, I am sure, because there are no social distancing constraints that are observed in these protests and so on, which of course are for a just cause, but there might be more than one price to pay. This question goes to Dr. Laws again. When can we see further easing of the lockdown?
And so before I answer the question, I think I concur with you in terms of what's happening in North America, the protests, and I think there's going to be a spike in the number of cases as a result of what we are seeing. Now, in terms, as I mentioned in my in the situation report earlier, we continue the gradual process of relaxing restrictions within the closed borders of St. Kitts and Nevis. And so as soon as the next iteration of the emergency powers regulations are published, you will see further easing of the lockdown. Thank you.
Thank you, Dr. Laws. This next question goes to Dr. Wilkinson. As we move to reopen our country, we will be looking for new quarantine facilities, as the one we have may be inadequate to hold a large number of students and residents who will want to return. Dr. Wilkinson.
Thank you very much, Lesboy. To answer that question, we must go back to the start of how we were handling this pandemic when it reached St. Kitts. And you would have known that our protocol initially was to have persons quarantined at home. But there were persons who were not taking the personal responsibility of quarantining themselves. And we were getting calls about seeing persons in public spaces, etc., who were supposed to be quarantined. I remember even at this setting here indicating that I was getting calls myself when persons saw persons wandering about when they were supposed to be in quarantine. And I said at the time that I was not the police. And because of this irresponsibility, we had to put firmer things in place to make sure that we contain the virus, and that's when we started to mandatory quarantine persons in a government facility. Yes, it is true that I think we only have about 50 plus rooms in the government facility, and as we move to reopen the country and welcome persons back, we have about 500 plus students who might have to return, and the economic activity that comes with that. We have a number of families outside there who are wanting to come back. And so it's one of two things will have to happen. We'll either have to look for a larger quarantine site, or we will hope that with the new norm that people are beginning to adapt to, that if persons are allowed to quarantine themselves at home, that they would obey the rules and regulations. And so it is still a moving target, and we'll have to come up with new protocols to see how we can accommodate the persons coming back. And just one last point I want to make about the large crowds and motorcades that persons were seeing. I just want to mention here, though, that it's not the length of the motorcade or the number of cars in the motorcades that is of concern, but it is the social distancing within the vehicles themselves. And so if you had a vehicle with family members, that might have been fine, but if you have a big truck with a number of persons who were close together without masks, who were not social distancing, then that is where the concern comes in. And so we're asking persons to exercise personal responsibility. I myself am very happy when I go to the supermarket and I see persons are adopting to the new norm and spacing themselves within the aisles. And let us continue to do that, because once we do those things, we will be able to open our country internally and then look towards the second stage, which is opening internationally.
This last question is for Dr. Laws. The World Health Organization recently put out that it's very rare that asymptomatic patients pass on the virus. Later on, they came back and said something else. Is there any evidence of the rate of transmission among patients who are asymptomatic and patients who are symptomatic? Dr. Wilkinson.
Okay, we know it's an established fact that the virus can be transmitted by symptomatic persons, and the persons who are symptomatic, they have the larger viral load, and these are the persons who are most infectious. It is also known that the virus can be transmitted in the pre-symptomatic period, that is before persons have symptoms, or even in the asymptomatic period, that is persons who have the disease but show no symptoms, or that these persons have a lower risk of transmitting the virus compared to persons who are symptomatic. Now, it was initially put out by someone from the World Health Organization that the risk of transmission in the asymptomatic persons was very low. But since then, that has been walked back. And even the CDC came out also with a statement making sure that persons were aware that the virus can be transmitted by symptomatic or asymptomatic patients. And even if we know that the risk of transmission in somebody who is asymptomatic or pre-symptomatic is less than that of someone who is symptomatic, the control measures that we know to contain this virus remains the same. Wearing the mask if you are suspected of having the disease so you can transmit it to someone else, and the social distancing. So nothing has changed in the non-pharmaceutical measures that we use to contain the disease. It's a fact, yes, that persons who are symptomatic are more infectious than those who are asymptomatic, but that doesn't change the price of cheese.
And this is our final question for today. Please let me know what is the number of persons to attend the funeral. Is the limited number done away with? Superintendent Henry.
The regulation provides for 25 persons to attend funeral, and that 25 does not include the officiating pastor or the persons from the funeral home who are working at the funeral. So 25 family members plus the officiating pastor and other workers of the funeral arrangers. Thanks.
Thank you very much for posing your questions, and I want to thank Dr. Laws and Dr. Wilkinson, who had most of the questions to answer today. Dr. Laws.
We cannot close this afternoon without officially extending warm wishes of congratulations to Dr. Marissa Carty. Today is her birthday, so please everyone join me in wishing Dr. Carty a happy birthday, Marissa. Marissa has provided us excellent support here at NEOC during our press briefings, and so we couldn't close without doing that. Thank you.
Thank you very much, Dr. Laws. In fact, I did have it noted here in my notes to wish Dr. Carty a very hearty, happy birthday. We won't ask her what is her age. So that brings us to the end of our briefing for today. We thank Dr. Lincoln Carty, who happens to be the father of Dr. Marissa Carty, for his donation to the COVID-19 response, to the forgotten, one of those forgotten groups, the courtesy clerks, which he referred to. Additionally, we thank Superintendent Cromwell Henry, who is always here to give his update on the law. Dr. Laws, our Chief Medical Officer, Dr. Cameron Wilkinson, our Medical Chief of Staff, and Mr. Abdius Samuel, Chair of the COVID-19 National Task Force and National Disaster Coordinator. We say thanks to all of you. We also thank Mrs. Christmas Jacobs for her faithful service to us here at the NEOC of providing sign language. We say thank you to ZIZ, Mr. John James and his staff at ZIZ, to Open Interactive, and to all the media who continue to partner with us in the fight against the COVID-19 pandemic. We also thank Ms. Vesta Southwell and Mr. Nigel Farrell for the work that they do on the communication team. We continue to thank everyone who continue to do their part in the fight against the COVID-19 pandemic. We will be back next week, Wednesday. Our next COVID-19 briefing will be next week, Wednesday, at 5 p.m. Next week, Wednesday, at 5 p.m. Until then, I want to thank you very much for joining us today and for keeping abreast of what is happening in the Federation of St. Kitts and Nevis with respect to the management of the COVID-19 pandemic. Of course, we continue to adhere to all the protocols that have been put in place so that we can be a better managed society where the COVID-19 pandemic is concerned. It will redound to the advantage, the health advantage of all of us. Until then, until next Wednesday at 5 p.m., thank you very much for joining us. I am Les Roy Williams.
Is on.